In our series of educational videos on Medicare Made Simple, today we're just looking at the topic of Medicare Part A, the important first part of the federal Medicare program. Here's what we're going to cover in today's video. Part A Basics, Part A Premium Costs, what Part A helps to pay for, and how and when to enroll in Part A. Well, my name is John DeShaw, and I'm a financial advisor with Solera Asset Managers and Insurance Agency. We're located in Roseville, California, outside of Sacramento. We are a local independent financial services office. I've completed the American Healthcare Insurance Professional Certification, and I'm certified to offer both Medicare Advantage and Medicare Supplement plans. I'm licensed and contracted with 8 of the major national and regional carriers, the most competitive Medicare plans in California and other states, so I can offer my clients several different options to choose from. But first, for compliance purposes, we must inform you that this is not affiliated with, nor are we endorsed by any government agency or the federal Medicare program. This is purely for educational purposes, and there will be no offer to buy or sell any products. Each situation is different, and you should consult with a licensed agent before you make any decisions. Well, we are only speaking today on this important first part of the Medicare plans, but for more detailed explanations on all the other parts of the Medicare world, you can check out our other videos. Before speaking, though, just on Part A, let's take a look at a brief overview of the basics of Medicare. Well, Medicare is health insurance for older and disabled American citizens and other eligible individuals. It's an individual insurance program. It's not a family health care plan. Each person must meet Medicare eligibility requirements as an individual, and each person is covered as an individual. So, for example, one spouse may be turning 65 and enroll in Medicare, while the other spouse is not yet eligible. Who can get Medicare? Well, first, Medicare is for U.S. citizens and for legal residents living in the United States for at least the last 5 years. You must be 65 years old or have a qualifying disability and receive disability benefits for 24 months. Starting with Part A as an overview, it's hospital insurance. It helps pay for hospital stays and inpatient care while you're in the hospital. Part B helps pay for doctor visits, outpatient care. Think of Part B as primarily helping with the cost of your medical care once you're outside the large hospital event. Part C is Medicare Advantage. It's an alternative to original Medicare Parts A and B, and it offers another way to get your benefits, including a Part D drug plan. Now, a Part D prescription drug plan, think of D for drugs. Remember, it's not covered by original Medicare, except in select circumstances, primarily when you're in a hospital event. You can get Part A by itself, or as I mentioned, as part of a Medicare Advantage plan, which Part D is in most plans is also included. Medigap. Now, you've heard of it. It's not Medicare, but Medicare supplement plans are offered by private insurance companies and are a common way to help people cover some of the out-of-pocket costs, the gaps that come with traditional Medicare A and B, like the deductibles and the coinsurance. Well, that's just a brief overview of Medicare. But let's take a look now more detailed at Medicare Part A regarding coverage. What does it pay for? Well, it helps to pay for hospital stays and inpatient care. Now, notice I've used the term and highlighted there, helps to pay. Often advertisements, brochures you'll see use the term covers hospital stays, which is both very misleading and incorrect. Part A helps to pay for hospital and inpatient care. One of the strongest points here is that you cannot be denied coverage for Part A. You can go to any qualified healthcare provider in the country who is participating in the Medicare program and is accepting Medicare patients. Now, some examples of what our Part A helps to pay for are operating room and recovery room expenses, along with drugs, supplies, lab work, x-rays used while you're in the hospital. Note that these services are regarding an inpatient stay. Regarding the premiums or what you're charged monthly for an insurance healthcare program like Medicare. Well, here are the basic costs for Part A. Medicare is funded in part by federal payroll dollars provided by employees and employers. Remember, all your working years and maybe if you're still working, you're getting a paycheck, it says FICA as a deduction. That's what Medicare is being charged from your paychecks. If you've worked and paid your taxes for 40 quarters, or the equivalent of 10 years, you qualify for Medicare Part A at no monthly premium or charge for the insurance. You've been paying for it all your working life. So the premium is $0 for most people, known as the premium-free Part A. However, if you have less than 40 quarters of credit, then you can pay for Part A. You'll pay up to $471 per month if you choose to. Now, you will pay a deductible, $1,484, if you're admitted to the hospital. This covers you for the first 60 days in one benefit period. But if you stay longer than 60 days, you'll start paying $371 copay for each day from day 61 to day 90. After day 90, you will need to tap into what's known as your 60 lifetime reserve days, which are $742 per day, which can get pretty pricey. You only have 60 days to use those lifetime reserve days. So after that point, you are then responsible for 100% of the daily charges, whatever they account to. Now, it's important to understand, as it says at the bottom, that Part A coverage and costs are based on benefit periods. A benefit period begins the day you're admitted to the hospital. It ends when you've been out of the hospital for 60 days in a row. Well, that means if you're admitted to the hospital multiple times in the same calendar year, you will have to pay the deductible again and the daily copays again each time. Unlike the traditional Medicare plan or medical plans that we're used to through an employer, where you just have one deductible plan for a year, not so with Medicare. Note in red, there is no annual out-of-pocket maximum on what you can be charged. Well, we've gone over what Medicare Part A helps to pay for. Now let's take a look at what it does not cover. Many people are surprised to hear that they're actually out-of-pocket costs. They could be significant depending on your individual healthcare needs. Furthermore, there's no out-of-pocket maximum, no financial protection with original Medicare. A serious illness or injury could create some real financial stress. Another possible surprise is that original Medicare does not cover prescription drugs as an outpatient for most situations, which can be pretty expensive as we get older. Other non-covered services include routine physicals, dental, vision, hearing care, glasses, contact lenses, hearing aids, long-term care, such as in a nursing home. It's not covered by Medicare. Custodial care, which includes bathing, eating, dressing, also known as the activities of daily living or the ADLs, not covered. Care received outside the United States, except in very limited circumstances, is not included. Now, the good news is that there are options that you have that can help with these non-covered items. Now and when to enroll. Well, you should be automatically enrolled, as I mentioned, if you are receiving Social Security benefits or Railroad Retirement Board benefits when you become eligible. You'll receive your Medicare card in the mail about the same time. If you're not receiving benefits, you will need to enroll when you're eligible. So go to ssa.gov/Medicare, as I've listed here, to enroll online, or go into a local Social Security office. We would recommend applying online. It's a lot simpler, no line. To go online, go to www.ssa.gov/Medicare, as we've listed it here. Select the Medicare enrollment. You'll see that down in the bottom right-hand corner currently on the website. Artwork might be changing up with their graphics, but that's what it looks like today. It's circled in red here for you. You will want to drop down a few screen links until you reach the How to Apply topic. Then select the blue window, which says Apply for Medicare Only. So it's not connecting to your Social Security retirement benefits if you don't want to start them yet. It's circled here for you. You will then read this document and agree if you do, checking off the box that says, I understand. It's at the red arrow that we've listed here. At this point, you don't already have My Social Security account, then you'll need to go back to the homepage and open up a My Social Security account. It's very secure. It's a great idea. I do it regularly. Encourage my clients to take a look at it also every few months just to see what currently your retirement benefits look like with Social Security if you've not already begun them. You would then select Start a New Application once you've got that account set up. You will now be able to select whether you want to enroll in Medicare Part A, Part B, or both. When to enroll in Medicare? Well, most people first enroll in Medicare during your initial enrollment period, or your IEP. Your IEP is 7 months long. It includes your 65th birthday month, plus the 3 months before and the 3 months after. If your birthday is on the first of the month, then your enrollment period begins and ends 1 month earlier. If you qualify for Medicare due to a disability, then your IEP includes your 25th month of receiving benefits, the 3 months before and the 3 months after. Now, as mentioned, you are enrolled in Part A and B automatically if you've been receiving Social Security or your railroad income at age 65. You'll get your Medicare card in the mail. Otherwise, you need to sign up yourself online, as we've explained, or at your Social Security office locally. Most people will want to enroll in Part B at the same time, but it's not free like Part A. So you may refuse or delay Part B enrollment and take just premium-free Part A. This may be a good idea for those of you who are already or still employed or have other coverage. However, some employers require you to take full benefits, Part A and Part B, at age 65. Medicare provides a special enrollment period for people who work and have employer coverage past age 65. You've got 8 months to enroll in Part B and Part A if you haven't already. We have a specific video if you're working past 65 and what to do. Check out my website, listed right here in the bottom right-hand corner, full video just on that topic. Now, we're only discussing Part A in this video, but Part A, Part B, and Part D may charge late enrollment penalties. The Part A penalty doesn't really apply to many people, since most of us are getting Part A at no cost because we've been paying for it all our working years. But you want to be aware of the Medicare enrollment periods as well for Medicare Supplement, for Part D drug plans, and for Part C Medicare Advantage plans, because they also have specific times that you can enroll. And if you miss them, you could face either big penalties or restrictions based on the coverage that you're available to get and at what time you can start it and at what price you'll pay. Your healthcare needs vary greatly based on your personal circumstances. We do these videos for a couple different reasons. First, and most importantly, we are your resource to educate and clear up any confusion that you may have around the whole Medicare subject. Secondly, we want to be your guides on this journey. You can check out our other videos to get more detail on the subject of Medicare. If you have questions or would like to schedule a virtual chat with us, here's our contact information. And on my website, you can also select choosing a virtual chat with me right on my website. It'll go right to my calendar and book your time with me. We are independent insurance brokers and specialists in Medicare. Our service to you is always totally free of charge. We've helped many people just like you through this difficult decision process, and we'd love to help you. Thanks for sharing this video time with us. Look forward to talking with you soon.